Thanks everyone to come, and I already have some introduction before, and let me give an outline of my talk today. The title of my talk is Anatomical and Functional MRI in Animal Models. I slightly changed the name from Neuroimaging to MRI because I want to make the talk a little bit short. So I'm going to skip the part that is not related to MRI, the optical imaging and electrophysiology recording. So in here today, I'm going to show animal model, translational MRI, and the advantage of using animal model. And I will separate the MRI into two parts, anatomical and the functional. So why the animal model is important? So I think this is a question that is for most clinical researchers. And this is because we want to learn some new knowledge. There's a human disease, especially in the brain. There's a behavior disease or brain disease, and we have some hypothesis. And this hypothesis, you need to test it. And if we use MRI, we need to have some physiological backgrounds and some biological background. And of course, there's a lot of hardware involved with the MRI instrument, the coil, and statistic and monitoring, and even combined with other modalities. And then with animal model, we have the Hello Kitty, or Mama Say in real, or Mickey Mouse, or Porky Pig. Then you can study the brain, their brain, and then from there you can imply some new knowledge, and then back to the human patient. One of the advantages of using animal model is that you can use a multi-modality to investigate the question. And because MR can only see one side, and then if you combine with electrophysiology or optical imaging, you can have more insight of the same issues. And also you can do pharmacological manipulation, and most importantly, there's a transgenic animal model that you can specifically manipulate the gene in order to study some disease or a very basic neuroscience question. And in here, the slides you can see, let me see if I can get this pointer. In this study here, they simultaneously record the electrophysiology, the LFP field potential, and then the fMRI signal. And then they can compare the electrophysiology with both signal. And on this slide here, on this study here, they do optical imaging inside the MRI. So they have a tiny MR compatible scope and the laser source, and then they direct the signal into the brain, and then study the brain simultaneously, both and the optical signal. You can also manipulate the brain function by using some drug. For example, here you're using the drug called fMRI, and this drug will inhibit the CBF, or more precisely, they will inhibit the nitric oxide, and then you can stop the CBF response. So you can see if you apply fMRI in here, the CBF response is totally gone. Before and after is very different. But if you compare the both signal, this is before, and both signals still remain a little bit, and we also want to check the CBV. And if you see the CBV, that's a reason you see the difference in the both, because once CBF is gone and then you still have some CBV remain, that is because vessel is dilating, although the blood flow does not increase a lot because you inhibit this one. You inhibit nitric oxide. So this is one way you can manipulate the brain function and study the neurovascular coupling. Another very big advantage of using animal model is you can do gene manipulation. Here's a small chart showing that from zebrafish, mouse, rat, marmoset, macaque, and human. The complexity of the brain went from zebrafish simple and to the human is the most complicated neural circuit. And the ability to manipulate their gene from the zebrafish has also the potential to human. There's no way. At this moment, you cannot manipulate or change the gene. So the marmoset model sits comfortably or in this in between, very balanced, because marmoset is also a primate, has a lot of white matter, much better than the rodents. And recently, on 2009, there's ability to do transgenic marmoset, make the marmoset a very good model to do basic science research. Another advantage of using animal model is compared to the clinical MRI. This animal magnet usually is much higher. For example, animal MRI have a 21 Tesla 11 centimeter bore, and human the highest field is 10.5, about half of the highest achievable animal magnet. And consider the SNR is proportional to B0 times exponential 1.7 times. So it's about the highest animal magnet is about 3.2 times stronger in terms of SNR than the human magnet. And also, animal has a stronger gradient. So, for example, animal MRI has a 1/500 millitesla per meter for 6 centimeter bore, and human only have 300 millitesla per meter at 56 centimeter bore. And this magnet is humongous. Actually, it is a 4 gradient combined together. So this is not much. It's really hard to push the gradient even further at this time point. So animal magnet really have an advantage here. And you can push a spatial resolution, and you can push the diffusion gradient. You can have a shorter echo time because you have a much stronger gradient. Also, coil has a higher sensitivity. So for example, animal coil now, there's a 15 channel, and the diameter is about 2.4 centimeter. And human has the best or the maximum we see so far is 96 channel, and each element is about 5 centimeter. This is it's huge already. So, and this is the 15 channel. There's no formula, but in general, SNR is better for the smaller coil size and for the smaller brain. So you also gain SNR from a better or smaller coil. And there's a prototype, there's a commercial available cryogenic coil, which can boost the SNR double in animal. But so far there's no cryogenic coil in human yet. So this all the advantage of using the hardware advantage of using the animal MRI. So the setup we have here at the Alfonso's lab, we have a 30 centimeter bore, and the gradient strength is 450 meter per 4 MT Tesla per meter, and the bore size is about 15 centimeter. And we have two kinds of setup. One is for anatomy. We use isoflurane anesthetize, and one for functional. We do that for awake or conscious animal. And physiological monitoring, we can do non-invasively for temperature, heart rate, pulse, oximetry, and also respiration rate and entitled CO2. So here's the setup for our anesthetized scan. So here's the ear bar, and this is the bite bar. And this is on 2010, we have 4 channel, and right now we have 8 channel here. So anesthetized animal is very good, or marmoset to be precise. It's good for study the anatomical structures. And one thing we can study is the myelination of the marmoset cortex. And as you can see from the literature, and this is marmoset S1, and you can see myelination is really well organized in the 3A and 3B. This is S1, primary somatosensory area. And also, you can see a very rich information from the myelination in the histology. And similar thing we can do with the MRI if we have a very high resolution MRI. So here is a myelin stain on the left, and compared to the MR with a high resolution 150 micron isotropic in vivo, and you can see this myelination stain correlate well with the MRI. The white area means a higher myelinated area. It's also true here. This is empty, and this high myelinated area in here empty. So we can also quantify the T1. The average quantify the area of the the myelination. So the cortex has overall have 1,000 millimeter square, and if you have compared to other area V1, VS1, and T, all this one, and for the V1 you can compare to literature. It's about 200, and our measurement is about 220, so it's not very far off. So that means our T1 MRI can really quantify or have a comparable measurement as histology. And one thing very interesting is the visual area in the marmoset occupy 1/4 of the cortex region. And this is true for most of primate, but it's not the case for the rodent, because rodent doesn't rely on their visual system a lot. And we can make the from the structure image, we can make the atlas from MR. Most of the atlas make the from the histology, but here we try to make the atlas just from the MR, from the diffusion MRI. And here we collect a bunch of the image, and then we do a classification, approximation from here, and here we got the atlas. And we can map our resting state MRI or the task MRI data onto this atlas. And we can also do a study to compare the structural connectome. So to compare our MRI-based atlas to the histology-based atlas. So here's the atlas we do in the ex vivo T2, and then we try to register to the in vivo T2. And the same transformation will apply to the atlas got it from the MRI or from histology. This from the recon, and this from the Paxino atlas. And once we do the transformation, and then you can see our MRI atlas did much better job in subcortical regions, and even better in the cortical region as well. And using this atlas, we can map our S1 activation and S2 activation. This is on the anatomical scan, and then we can translate to the atlas directly. You can see it matched S1 and S2, and even this thalamus activation here. Also, you can see that in the auditory studies, auditory fMRI. And if we do a paralateral sulcus cut like this way, and this is the somatosensory area, and you can see very nice activation here, and which corresponding well with the auditory cortex on our MRI-based atlas. Another thing we can do for study the cytoarchitecture of the brain is we can do the DTI to study the white matter track. And then, for example, this one we have we scan the brain with 4,000 B value and 30 directions. The resolution is about 150. You can see really nice orientation of the brain. And if we push further, and we get even higher, more direction, then you can see this, for example, here you can see there's a separation of different fiber running in this area here, as well as here, which is not easy to see if you have much less direction and less gradient strength. So here we show a T2 star map of the marmoset, and this is a very interesting study did by Pascal, and they study the brain in two positions, spine position and sphinx position. Sphinx position is usually what we have for the marmoset and most of the rodent studies. And the spine position is mostly seen in the human patients. That means the B0 is running in this direction, and in here, B is running through plane, in and out of the plane here. And the biggest difference you will see is in the white matters, because the white matter is B0 magnetic field dependent. So if you look at the white matter 1 here, in sphinx position, you measure T2 star is about 25. But if you measure in supine position, it's 29. On the other hand, if you look at WM2 here, it's 32 and it's 22 here. So the T2 star value is really depend on your magnetic field.
So what is the reason for that?
That's the direction of the fiber. So if the fiber is perpendicular, for example, let's say optic radiation. Optic radiation is running laterally. And if you running laterally and you measure with in plane, that is here, and then you will have a higher T2 star. But it is perpendicular, or sorry, if it is perpendicular, it's low, it have a higher T2 star. If it's running in the same direction or a little bit parallel, then it's much lower, it's 22. It depends on the susceptibility induced by the myelination. So T2 star mapping is really magnetic field orientation dependent. Also, you know that it's also field dependent. So this is our setup for anesthetized animal for spinal cord imaging. And here you can see this is the cradle. Animal can lie in supine position here. And we have 12 channels all over the spinal cord of the animal. Because the length of the bore or the gradient, so we have to imagine this in 3 segments. One, so this is cervical, and this is T throat, and this lumbar, and CTL. And we have to run this in 3 sessions. And here they try to using the MR to detect the lesions. This is tiny lesion here, and you can see 2 lesions here and 1 lesion here. And the resolution here is about 125 micron implant. And this is really, really good compared to what human did in spinal cord. This is only available or achievable in the animal system. It's hard to achieve in human system. So here is our setup for the awake marmoset, and we have a marmoset sitting in here in sphinx position. We have a camera either monitoring the eye or monitoring the behavior of the marmoset, infrared, because inside the bore is dark, so we need the infrared. And reward is only given when we do visual simulation, as well as this the screen. If we don't do visual simulation, then we don't need reward or the screen. And the core here, we have 8 channel. And recently, we developed a 10-channel phase array. And you can see it's very symmetric compared to what you have here. And you can do a higher acceleration factor for a 10-channel array. So what we can do with awake fMRI is the first thing we do is we try resting state fMRI. So here is a resting state default mode network we defined in the marmoset, which is resemble the human default mode network. And also we also find the smart sensory network here, and also a higher order visual network. This is all in the awake setup. So you may wonder why, what is the difference between awake or versus anesthetized? So this is a study we did to compare what is the effect of propofol to the hemodynamic or bold response. As you can see, in the awake marmoset, you have a stronger, and also you see thalamus activation, and also, especially in S2, is much stronger. But if you have propofol or propofol plus fentanyl, they all diminish, especially the thalamus, and S2 is much smaller, unlike you have in awake. I think that's one of the effect of anesthesia, basically suppress the neuroactivity. And if you compare time to peak, it's even more clear. As you can see, this is awake marmoset, and you have a much faster onset time, about 0.5 seconds faster than if you have a propofol or propofol plus fentanyl and anesthetized animal. And the response is almost 2 times stronger as well in S1. And in this study, we try to differentiate the forearm stimulation versus high feet stimulation. And this will stimulate both either area, and then we try to correlate with the anatomical T1 map we get before. And we can nicely separate these two regions if we can go back and forth. So this is the forearm, and this is the leg. And this corresponding to this area and this area. And this is a face area. So this is the 3 biggest patch of the highly myelinated area in the S1. So in this study, we also can do very high spatial temporal resolution. So in here, we do acquisition every 200 milliseconds. So we got 5 frames or 5 images per second. And we do very high resolution, 0.25 by 1 millimeter fMRI studies. So in this study, I try to detect the onset time difference of layers. So this is a general activation T1, in the S1 areas. And this is the caudate areas. And we separate this S1 region into 16 or 5 layers. 1 and 2, 3, 4, 5, 6. And these 6 layers, we can see what is the difference in these 6 layers. As you can see, this is a time course, and this is a T1, a T-map time for generate each 200 milliseconds. You can see the slide undershoot at the end here, and it will slowly go back to the baseline at the end of 28 seconds. And we can wait a little bit, and you will see the onset here, beautifully S1, S2, and very strong here as well. And then once the stimulation stops, it go back, and then similar undershoot you see. You can see already here there's a difference between layers of the bold response. So if we sum up 2 seconds to 6 seconds just to see the average response of each area, and we also separate the bold response into T2 star and 0 because we do dual echo, so we can separate this bold signal into 2 components. You will see that the bold is higher in general, it's higher on the upper area and it's low on the bottom at like layer 6. The most interesting thing is, since we believe the bold is mostly T2 star, so T2 star follow well on layer 3, 4, 5, 6, but there's some discrepancy between the T2 star and the bold, because T2 star is slightly lower in the layer 1 and 2, but it is still very high in the bold. So there's a difference is in the S0. S0 is the remaining factor after you feed the T2 star component. So this S0 is mostly contributed by the vans, the big PR vans, And also there's a partial CSF contribution on these regions. And this is where you see the bold and T2 star become decoupled. We can also do auditory study in the wake marmoset. In this study, we compare high frequency tone versus low frequency tones. As you can see, this high frequency tone and low frequency tone give nicely response. And in here, we contract between high and low. So you can find this high, low, high region in here. And that is corresponding well with the histology of the auditory system, which have a tone topic mapping. And here we have doing a visual simulation in the marmoset. Visual simulation actually is one of the most difficult fMRI study because not only we have to train the marmoset to stay calm inside magnet, we also have to have the marmoset to fixate on the screen. So here's the block design we have, and this is we presenting the face over this 16-second block, and we will reward the marmoset when the marmoset is actively engaged and look at the screen. And here I will show a very interesting video. So this is a synchronized visual simulation versus marmoset. This is the face here. We do more eye tracking. And before the stimulation start, okay, this is start the stimulation. Marmoset really engaged to look at the screen, the dot, and then we will start to show the face. And then the animal will lick the tube here because they know there's a reward coming. And once the stimulation is done, and then animal knows, okay, there's a break, and then they start to doze off again. That's the typical way, a typical visual stimulation paradigm we have. And here's the response in all the area, in the, for example, occipital lobe area. We see really nice response for the face, object, or in body. Then there's a more specific to the face select region here. And you can see face is the highest response in this two patch. And this is body select region, highest for the body selection in this region. And to summarize, here's a face patch we find in a awake marmoset. And you can see in area O, face, the green part is highest response, PV, and PD, MD, and AD. This is the 1, 2, 3, 4, 5 face patch we find. And suppose there's an MV face patch we use in the ECOG to find it. And we didn't see that in fMRI because the sensitivity is not high enough in here. But this 6 patch is also reported in the macaque or in the human. So we conclude that the marmoset also have a face patch that is similar to the rest of the primate. So to recap, there's a few advantages of animal models. So this first allow the multi-model investigation, and we can have a dedicated hardware permit higher spatial temporal resolution. And marmoset is a very important experimental model for translational research because you can do transgenic marmoset. Anatomical MR of the marmoset brain and spine can be obtained with a remarkable psychoarchitecture detail that can be studied the disease or to study the very basic function of the brain. And functional MRI can be used to study the functional connectivity or various sensory systems, including smart sensory, auditory, and the visual areas. So thanks for everyone, and here's our lab, and our chief is Afonso Silva, and he's currently out of town. And we have a research fellow, and Senho and myself, and we have postdoc fellow, Zhongen, Shirong, and we have a student, and we have postbac and lab technician Lisa, which is one of the most important lab in the lab. Okay, thanks very much. And you still have time to go out to see the solar eclipse if you want. Thank you.